Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining us is Dr. Ramon Tallaj. He's the founder and chairman of SOMOS Community Care. We're going to discuss how governments can support immigrant communities with COVID-19 medical care and treatment. Doctor, it's great to have you with us on the show. Thank you so much for joining us on Trade Talks.
It's my pleasure.
All right, and if you could tell us a bit about SOMOS Community Care.
Well, SOMOS Community Care is a 2,000 healthcare workers, more physicians, primary care in New York City, who take care of close to 1 million patients in the 4 more poor neighbors of New York City. Normally, we do close to 50,000 visits every week with our patients. I'm sorry, a day.
Wow, that's a really big number that you serve each day. Now, according to New York City data, Black and Hispanic New Yorkers are dying from COVID-19 at about twice the rate of white New Yorkers. Why is this happening?
It's so simple. The inequity was there already before the virus came in. We call it solid virus. The difference is now it became more clear that we are disparity. I mean, we live in apartments where 10, 11 people, 1 bedroom, 1 bathroom. It's very difficult, first, to keep the distance at 6 feet. One will be out of the door or will be out of the window. At the same time, when we get tested, if we find a test and somebody comes positive, we send them back for the building. There's no isolation. And remember, these apartments are multi-generationals. Therefore, our grandparents live with us, and these are the ones dying at high rates. Our buildings, which all these apartments, are a nursing home of the Hispanic community.
So what can someone do to protect themselves? It's not easy for everyone just to move and go to the suburbs and get a bigger home. I mean, this living in New York City, living in apartments, this is our home. And as you had mentioned before, it is multi-generational. So what advice do you have for families to protect themselves?
If I had to roll over again, what I saw back in March 21st, we started first testing site in Queens, March 18, and we saw the same thing happening in the Bronx. We opened 2 days after, that 70% were positive. If I had what I know now, and by then, I would ask them to go and move the sick people to the 12 floors and the other people, the healthy people, to the lower floor. But that never happened. We were looking for the isolation, which never happened. And at the same time, protect the kids. The kids are the one, we've been saying that from the beginning. They are the one who has most likely had the disease all over, because you cannot clean their hands so frequent. You can avoid them to be on the floor and touching everything.
So let's talk about some of the innovation that you're employing at SOMOS Community Care.
Well, we were able to put more than 2,000 healthcare workers in the same platform. That means the same type of, even have different computer systems, we have the same protocols. We were created to reduce 25% admissions, avoidable admissions, and ER visits. We went above that. In 2018 alone, we saved to the state government $336 million, not to tell you about what they call accountable care organization, that we saved to the federal government $144 million in 4 years, being the #1 in the state of New York for 4 years in a row. This is why be able to put all these doctors together to take care of minorities. Remember, we are not in Park Avenue or in Fifth Avenue. We're all in poor neighborhoods. We open the door to serve because we are immigrant like them. That's what we do our services to people who are the same like us.
So once we get to the other side of COVID-19, I'm hoping that some healthcare lessons could have been learned in terms of how we practice our own personal hygiene, in terms of the administration around conducting healthcare, in terms of the quality of care, and even if a treatment is available, is it going to be cost effective enough for everyone to have access for it? Do you think we have learned anything throughout this healthcare crisis? Will things get better on the other side?
I hope so, because definitely value-based payment, we call it value-based quality, is the way to go. You don't have to be in the old time and call it fee for service. We were fast, good enough to move into the community. We weren't afraid. If for the first time, the things are good for the patients, are not necessarily bad for the doctors. That's why we were able to ask and work so fast to deploy ourselves in the community. We put telemedicine by the end of February. We have 1833 SOMOS NY in 3 different languages. Anybody with insurance, without insurance, with papers, without papers, access to our doctors to be able to talk to us. This is how we find out right away what was going on. And at the same time, we avoid so many people to hit the emergency room because doing telemedicine was so easy for us.
Yeah, telemedicine really, it's quite incredible to see what's happening with technology in healthcare, just in general. If this were to have happened, let's say back in 2008, 2009 during the financial crisis, let's say it was a healthcare crisis, we would not have been able to get any kind of treatment. It just didn't exist back then. So it's a good thing to see technology moving along. Doctor, do you think that some people are afraid to seek treatment?
Let me go with the numbers here for you to know.
Yeah.
Before, we did what they call State of Latino Health. And 60% of the people in the Bronx speak Spanish, but only 10% of the people who are physicians or workers in healthcare do the same. We are the middle. We are the one in the sensitive, cultural manner doing the service for them. At the same time, think about this. 50% of people lost their jobs. 50% have less than $500 to buy food. That money is gone. This is why we start doing what we do. Now we're feeding the people because we know that's the next problem. The sanitary crisis is becoming a humanitarian crisis. And one more, you should know, based on Nasdaq, we went the 16th of March to start testing the stock exchange to be able to be sure that the people going to the floor were not positive. We did all that work, as you know, in humanitarian work. We don't charge for anything like that. All of our work that we had done, the physician is being free. We haven't asked for any penny. We actually put the money to buy all the testing sites, testing kits, all the signs, everything you see, we pay for it, the doctors.
Yeah, that's, we certainly thank you for your service, and we hope that this helps to get the word out there and that we can get money and resources back into the communities that need it the most.
I hope that the resources that is being come to our community, they should see. We need now more help from the federal, state, city government to continue doing testing, to get food to our people. And we're already starting this coming week. We have 120 practices. It's like we call it the bizarre war. Because now the people already have been through the disease and survived, our doctors, our employees, we test all of them, and now we know who got IgG positive. We open all the offices with them to be sure that our patients, especially the kids, we don't want an epidemic within the pandemic. This is why we open the doors right away.
All right, Dr. Tallaj, thank you so much for joining us on Trade Talks.
You're welcome.
All right, and thanks for joining me. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.